Hi, I'm Dr. Christine Doherty. Today I'm going to talk briefly about the naturopathic approach to celiac disease. Now, celiac lends itself, I believe, perfectly to the approach of naturopathic medicine because it's a holistic disease. It definitely affects more than one specialty. It's a disease that doesn't do well when you have to break it down to the psychiatric effects, the neurological effects, the dermatological effects, the gastroenterological effects, the endocrinological effects, and those are just a few that are common specialties that need to address the common and multisystemic symptoms of celiac disease. The other thing about celiac is that there's no drug treatment for it. It really is only the gluten-free diet that treats it. That said, the gluten-free diet can be a lot of different things to a lot of different people. Just because it's a gluten-free diet does not mean that it's a healthy diet. So the goal is to work with a doctor who understands the realities of going with a more whole grain gluten-free diet so that you can try to reverse some of the deficiencies. A really shocking statistic is that 50% of celiacs still have multiple nutritional deficiencies 10 years after going gluten-free. So often by the time people are diagnosed with celiac, they've had it for a long time, they've had nutritional malabsorption. Often they've limited the foods they're eating before diagnosis because they just don't feel well. And then they switch to a gluten-free diet. And the grains in many cases are fairly stripped of their nutrients. There are a lot of very white grains, and they tend to be higher in carbohydrates than even the regular gluten-containing versions. Let's say, a piece of bread would actually be, in a lot of cases, more nutritious as a gluten-containing bread than as a gluten-free version of it. So if you're already going into the diet with deficiencies, going into a gluten-free lifestyle that's lower in nutrients, I'm sure you can do the math and realize that a lot of nutritional deficiencies don't get repleted and nourished. So that's where I think supplements can really play an important role. And unfortunately, most medical professionals these days aren't trained in the use of supplements because quality really does matter. It's a holistic approach to look at which supplements are going to work well. It isn't as simple as just taking a one-a-day multi. In a lot of cases, people need digestive enzymes. You see a lot of things like lactose intolerance, even fructose intolerance, which is a lot like lactose intolerance, but it's an enzyme that breaks down the sugar fructose, which can cause a lot of those same symptoms as lactose intolerance, meaning gas and bloating. So those are the people who go gluten-free, but they still have lingering digestive complaints. So those are things that when we really look at a thorough history as a naturopath, that we can pick up effectively and then test for if need be to see if those are other features that are complicating an individual's gluten-free diet. The thing about the gluten-free diet, I think, is that it's important to test people for celiac before you go on a gluten-free diet, if possible. Now, I know practically speaking, a lot of people don't get tested first. The reason to get tested first is you may be the first person in the family to get detected as having celiac. And it's also a long-term compliance issue, meaning you might start to feel better and then you start to eat a little gluten. You might not necessarily have symptoms when you do. And unfortunately, celiac tends to morph in that, at one point you may have gotten diarrhea when you ate gluten, but later on you may not. But the risk is that you may be marching down the road to cancer at a faster rate if you're eating gluten, and you're not necessarily going to have the warning signs. And as I mentioned in the beginning, there's a lot of possible symptoms to celiac. So, you may have diarrhea, constipation, let's say, but someone else in your family may have a rash, or someone else may have primarily depression or anxiety or ADD. So not everybody in the family is going to manifest a celiac the same way. So once one person in the family gets picked up, in theory, and unfortunately I don't see this very often in practice, the rest of the family, the first degree relatives, should also be tested. So that's parents, siblings, and children. And then that's going to help to really increase the diagnosis rate of celiac disease in this country. There's a lot of people who benefit from a gluten-free diet beyond those that are just strictly celiac, but I think it's important to know going into it whether for you it needs to be a lifelong thing or not, and whether you're at risk of a lot of the nutritional deficiencies that come more specifically with celiac than some of the other things that lead to the gluten-free diet, like gluten sensitivity, let's say. There's also gluten intolerance, which is more digestive, and of course wheat allergy. And the people who have the wheat allergy are the ones that can actually eat barley and rye. So sometimes you'll see products that say wheat-free, but they're not technically gluten-free, and often they contain barley malt. So to recap, a good reason to see a naturopath is that, we can really look and make sure you're doing a healthy version of the gluten-free diet, but also add in the supplement piece to screen for symptoms of nutritional deficiencies, because it's not always easy or practical or even functional to blood test for every single nutrient. It's just not really something one can do. And because some nutrients just don't test well, they don't reflect well in the blood what the stores in the body actually are. So that's where it can really make a difference in people's recovery, because I've been specializing in celiac for about 9 years now. I also have been gluten-free myself since then. I really credit the gluten-free diet with saving my life personally. And so I'm really passionate about it, and I've worked with thousands of people from all over the world and all over the United States. So I've seen a lot of people have been gluten-free in many cases for even decades, and they don't always feel better. They have residual mood issues. They're still fatigued. They're still not sleeping well. And I say mood, I primarily say anxiety and depression residual. And a lot of those are symptoms of deficiency. So once we really kind of, get them on the right supplements and get them feeling better, it's amazing how they really then can start to enjoy the best quality of life, which is ultimately the goal. So if you have any questions, you can contact me at info@pointnatural.com. My website is Balance Point Natural Medicine is our clinic, and the website is pointnatural.com. And also you can find information about recipes and articles I've written about being gluten-free on glutenfreevitamins.com. Thanks.